Hi, today's topics that is otitis media. That is otitis media. So under that we'll learn in introductions, definitions, causes, sign and symptoms, diagnostic evaluations, medical managements, nursing managements, and complications. So otitis media, that is the inflammations of the middle ear. Okay. So otitis media is common childhood illness characterized by inflammations of the middle ear. Okay, in this ear, in the middle ear, inflammations and fluid accumulations in the middle ear. So otitis media is an infections or inflammations of the middle ear, which is the filled space behind the eardrums or tympanic membrane that contain the tiny vibrations bone responsible for transmissions. So in this area, inflammations and fluid accumulations will be there in the middle ear. So next we'll see the definitions of the otitis media. So definitions of otitis media, that is otitis media is an infections or inflammations of the middle ear behind the eardrums or tympanic membranes. Next we'll see the types or classifications of otitis media. So there are three types of otitis media is there. One more is acute otitis media, chronic otitis media, and otitis media with effusions. Okay. So acute otitis media, that is sudden onset severe symptoms, that is typically acute otitis media, that is typically caused by bacteria or viruses also. And next we'll see the chronic otitis media. So chronic otitis media, that is persistent or recurring infections. Next we'll see that is otitis media with effusions, that is fluid accumulations in the middle ear without acute infections. So that is otitis media, means fluid in the middle ear without infections. There will be the no infections. Next we'll see the causes. So causes, the other name of causes, that is we know that is a etiology. So causes, what are the causes? So here main causative causes are like bacterial infections, viral infections, allergies, Stesian's tube dysfunction. So bacterial infections such as like streptococcus, pneumonia, viral infections, example like respiratory viruses, allergics, S2 Stesian tubes dysfunctions will be there. Okay, so these are the causes. And next we'll see that is about a risk factor of a otitis media. So risk factor of otitis media that are under the age 15 years, and family history, allergies, respiratory infections, Ehlers adenoid, Down syndrome. So these are the risk factor of a otitis media. So next we'll discuss that is about a pathophysiology. So pathophysiology here that is what due to the etiological factor. So here what the etiological factor, it may be a viruses or it may be a bacteria. And next, serious exudate and edema in the middle ear. Okay, since swelling will be there in the middle ear. And after that, first formations. Okay, first formation formation means here some yellowish pale yellowish discharge will be there. Okay, next tympanic membrane will rupture. The tympanic membrane will going to rupture, and it will lead to a otitis media. So otitis media means we know that is the infections or inflammations of the middle ear. Next we'll see that is about a sign and symptom. So here sign and symptoms, basically here otalgia. Oto means we know, oto means that is a ear. Algia means that is a pain. So ear pain will be there. and fever will be there. uh, Hearing loss or difficulty hearing, otorrhea. Otorrhea means discharge, ear discharge will be there. And irritability, loss of appetite, the persons will not feel hungry, vomiting will be there, diarrhea, rhinitis, vertigo. So these are the sign and symptoms or clinical manifestations of a otitis media. Next we will see that is a diagnostic evaluations. So in diagnostic evaluations, first of all we have to do that is a history collections and physical examinations. Next we will do that is a otoscopy. Otoscopy. Next, that is a tympanometry. So tympanometry, that is a procedure that will examine the auditory canals and tympanic membranes for infections or blockage. Next we require that is a audiometry, that is for hearing test. And next, imaging studies. So under the imaging studies, like example like CT scan, MRI scan, so this test we have to do. Next we'll move on management. So in the management, first of all we will see that is a medical management. So under the medical management here, basically this otitis media that is caused by a bacteria. So we'll provide antibiotic medications for a bacterial infections. And next we'll provide that is a pain is there, so we'll provide pain management medications, example acetaminophen or ibuprofen. And next we'll provide that is a antipyretic medication because fever is there, so for fever we'll provide paracetamols. And next we'll provide that is a decongestants or antihistamines for we'll provide antihistamines for allergics, example like cetirizine. Next we'll move on that is surgical management. So in surgical management here, tympanotomy. So tympanotomy, and next is tympanostomy tubes. So these are the surgical surgery we have to perform. And next we'll move on, that is a nursing management. So in nursing management here, we require two nursing managements. That's one more is pre-operative nursing management, and next is a post-operative nursing management. Pre-operative means before the surgery, what are the what managements we have to do, what we have to plan, okay, before the surgery. That is about a pre-operative nursing management. Before the surgery, what are the nursing managements that. And next that is a post-operative. Post means after the surgery, okay, what step have to take or what step has to follow that. So in pre-operative nursing managements here, we have to assess and monitor the symptoms. And next we have to provide the comfort measure to the patients. And next family member consents we have to take. We have to administer the medications as prescribed, example like analgesic medications. And next we have to explain the procedure to the patients, and we have to encourage and psychological support to the patients. Okay, so we if the patient is have any fear about the surgery, so we have to encourage and we have to give support, we have to give psychological support to the patients. Next we'll see that is a post-operative. In post-operative, we have to assess the vital signs, and we have to monitor the input and output chart. Okay, and next we have to tell the patients for rest, to take rest after the surgery, minimum 2 hours. And next we have to provide pain management medications as per doctor prescribes. And next we have to explain the patients for about the daily hygienes and supplements. So these are the post-operative nursing management. Next we'll see the complications. What will be the next complications after the surgeries, or that is hearing loss will be there, mastocytitis, speech delay, chronic otitis. Okay, so these are the complications of a otitis media. So today we have learned about a otitis media. Under that we have discusses that are definitions of the otitis media, causes, risk factor, sign and symptoms, pathophysiology, diagnostic evaluations, medical management, surgical surgical management. In nursing management there are two nursing managements. One is pre-operative and next is post-operative, and after that we have discussed that is complications. So complications of otitis media that are hearing loss, mastocytitis, speech delay, chronic otitis media. Okay, thank you.